Alright, hi there family and friends. I wanted to make this video to talk about and teach you about diabetes and about basically what it is, and then what the blood sugar should be, and then also kind of what to eat, because that's one of the biggest issues in diabetes. Yes, one of the issues is going to be diet. One of them is going to be exercise or lack of exercise. And the other one is going to be the medications. But the medications should be used to help you control the blood sugars, not to let you eat more. So let's talk about first, what is diabetes? Okay, the word diabetes is, if you cut the word apart, so dia, D-I-A, means through. The betes part is kind of from Latin, meaning bete, like to go. So to go through. Now the word mellitus or mellitus, diabetes is termed diabetes mellitus or diabetes mellitus. Mellitus or mellitus means something sweet or honey-like. Put the word together, it means something sweet or honey-like going through the body. Now back in the day when they first described diabetes, the reason that they knew that something sweet was going through the body is that they would actually test urine by tasting urine. They didn't have the technology we have today, and so when somebody would, like for example, pee by this tree, or pee by another person would pee by that tree, the scientists would go and taste that urine and it'd be, nasty. They would go to this urine, they would taste it, it would be nasty but sweet. They didn't know what it was yet, but it was technically sugar that was going through the body, and the body was trying to get rid of it. When your body has a blood sugar generally of about 180 on a daily basis, your kidneys, they try to help you get rid of the blood sugar. And so they open up the doorway and you start throwing sugar out through your urine. Sugar and fluid have a nice attraction for each other. And when you throw out sugar, you're also going to be throwing out fluid. And then when you throw out sugar and fluid, you lose your volume or the fluid in your body, and it makes you thirsty. So then you're throwing out sugar and fluid, you get thirsty, you drink more fluid, and then we eat food that has sugar or that converts to sugar. We're throwing out sugar and fluid, drinking sugar or drinking fluid and eating sugar. And it's a vicious cycle that happens in diabetes. So let's talk about, in diabetes, there's two big organs that play a big part in diabetes. One is going to be the pancreas, and the second one is going to be the liver. So let's talk about the pancreas. Now the job of the pancreas is to make insulin. So picture this, when we eat food, our stomachs tell our brains tell your pancreas, and then your pancreas gives you insulin. Okay, what is insulin? Technically, insulin is a hormone, but think of it like a key. Now picture every cell in our body as being locked. And when we eat food, sugar from food, or any sugar, can never get into the cells. So if we have a cell and the sugar can't get in the cell, where is it going to go? It's going to stay in the bloodstream. So the insulin acts like a key, opens up the door, puts the sugar in the cell. That's where we want most of our sugar, because that's where we turn it into energy so we can walk, talk, think, breathe, have a heartbeat. So we need the sugar to get into the cell. Now we need some sugar in our bloodstream. Now in our bloodstream, we need normal sugar. Why do we need sugar in our bloodstream? Well, our brain and our muscles run on oxygen and sugar. If we don't have oxygen, we die. If we don't have sugar, we go through a lot of stages before we die. And we'll talk about that in a little bit. So the job of the pancreas is to make insulin. Think of your pancreas, it's like a little faucet, and it's actually dripping insulin every hour throughout the day. Kind of like drip, 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 drip. And then when you eat food, it goes, oh, you're eating, and it's like a little faucet goes on. And then the pancreas gives you more and more insulin because it wants to get the sugar out of the bloodstream and put it into the cell. So that's the main job of the pancreas, is to get the sugar, the excess sugar, out of the bloodstream and put it into the cells so we can use it for energy. Now our liver does a million things for the body. It makes proteins, it makes clotting factors, but two important jobs. One, it makes sugar. The second, it stores away sugar. So let's say we eat the rice. Your body's going to take some of the sugar from the rice and it's going to put it in the liver, like a bank, for later that day, the next day, or the next day. Now, this is strange, but picture your liver all day long is actually dripping sugar. Drip, drip, drip into your bloodstream. Drip, drip, drip. Strangely, when you don't eat or don't eat enough, your liver turns on the faucet and you get drip, 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 more and more sugar. Now, that's one of the jobs of the liver. So the pancreas's job is to make insulin. The liver's job is to make sugar. When we skip a meal or we don't eat, the sugar starts to drop. Your liver's like, ooh, let me help you out. And it gives you extra sugar. The pancreas is supposed to say, what's going on over there? And it sends out the insulin to put the sugar back in the cells to keep it balanced in the bloodstream. Well, that's what breaks in diabetes. And it's not the liver that breaks. The liver keeps making sugar. But it's the pancreas that makes less and less and less insulin. Now, in diabetes, there's two main types. There's type 1 and there's type 2. There's also one called gestational diabetes, and that's what women get in pregnancy sometimes, but we won't talk about those. Now, type 1s, those patients get diabetes when they're young. Picture they're like 10, 7, 3 years old. Theirs is an autoimmune disorder. That means that their own body attacks their own pancreas. Why? They don't know. It's basically the body sees the pancreas as a germ, as a virus, as a bacteria, and it just destroys it. And so picture if you have a 3-year-old, the body has attacked the pancreas, destroys the cells that make the insulin. Now they make 0 insulin. But the liver still makes, we'll say 100% sugar, right? They don't have any insulin though. They still got to eat food. So their sugars can be, picture something like 200 to 2,000. They can't live long in the thousands. They'll have a seizure and die. So they take insulin from the outside every day, all the days of their lives, from the time they're 3 years old till they're 93 years old. That's a type 1. Now, type 1s make up 10% of all the people with diabetes in the world. The other 90-ish%, those are type 2s. Now, type 2s generally get diabetes when they're older. They're usually 40, 50, 60 years of age. Can be younger, can be older. So picture a 50-year-old when they are 20. Well, their pancreas, when they're 20 years old, is making 100% insulin. But through the years, because of their age, ethnicity, genetics, diet, lack of exercise, whatever, they go from 100% of their insulin production to 90, 80, 70, 60, 50. When they're at 50%, that's pre-diabetes. When they go 40, 30, 20%, now they are technically a type 2. You got to picture the other side, the liver. It still makes 100% sugar. They still got to eat food, right? Well, they don't have enough insulin like they did when they were 20 years of age. They had 100%. Now they're 50 years old making 20%. This side hasn't changed. This is the side we have to change through diet, exercise, pills, and sometimes insulin. Because we can't really make this side fix itself. Some medications can stimulate the pancreas to make a little bit more insulin, but it's not enough a lot of the times to counter this. So we have to watch our diet, exercise, take medications, pills, for example, and like I said, sometimes we do have to take insulin. So that's the difference between a type 1 and a type 2. Now, people aren't a type 2 and then become a type 1 just because they take insulin. Patients or people who are type 2s who take insulin are just type 2s who take insulin. So that's the difference between a type 1 and a type 2, and that's what the pancreas does and what the liver does. Now, I'm going to try to make this video kind of short, but there's a lot of information that I want to give you. So to help you in your diabetes journey, I made a little ebook. Now, in this ebook, there's going to be information about the plate method, like how much carbs should be on the plate, how much vegetables, how much proteins, what blood sugar should be, kind of describe what we talk about here. And to make it available for you, I'm going to set it up where it's going to have to be through an email. That's the only way I can do it. But what you'll do is you'll click on a link and you'll access an area where you just give your email and then you can download the information. And it's not that I want your email, but that's how the easiest way I can set it up. That's how I kind of do it for other things. But basically you open up the link. It says download your diabetes ebook, and then you'll click on that, put your email in there, and then it'll actually send it to your email so you can download it for yourself or for your family. Okay, so let's talk about what blood sugar should be. Now I'm going to talk about first patients or people who are less than 65 years of age, and it's a little bit different when they're 65 years of age and older. So when you're less than 65 years of age, at the 2-hour mark, from the start of that first bite to 2 hours later, you test your blood sugar. You should be between 70 at the low and 140 at the high. We consider anything under 70 to be a low blood sugar. And this will be in the ebook also. Anything over 140 is a little bit too high. So between 70 to 140, 2 hours after the meal, 70 is too low, and above 140 is too high. Now, when you wake up in the morning, your fasting blood sugar, this is basically 6 to 8 hours without eating. So when you wake up in the morning, your blood sugar should be between 70 and 110. So again, fasting 70 to 110, 2 hours after a meal, 70 to 140. For people 65 years of age and older, fasting blood sugars should be between 70 and 130. And 2 hours after the meal, between 80 and 180. The low is still 70, and then the high would, for 65 years of age and older, would be over 180. So again, fasting 70 to 130, 2 hours after the meal, 80 to 180. Those numbers are from the American Diabetes Association. For less than 65, we use an organization called the American College of Clinical Endocrinologists. And the reason for the difference, as we get older, our bodies may not tell us when we have a lower blood sugar. And low blood sugars are a little bit more dangerous than high blood sugars. High blood sugars basically can cause damage and kill us and take away our quality of life over years and years and years. But low blood sugar can kill us in minutes. So what are signs and symptoms of low blood sugar? You could be shaky, sweaty, dizzy, have a headache, be fatigued, tired, be angry, be irritable, and have a fast heartbeat or heart palpitations. Those are symptoms of low blood sugar. Those are the body telling you, hey, let's do something. Our blood sugar is getting low. So picture if your blood sugar is starting to drop in your bloodstream. Basically, your body's looking at the bloodstream and it says, where's my sugar at? And it says, you know what, give them a headache. And then let's say, you're busy, you'll say, I'll eat later, I'm getting a headache, I haven't eaten, but I'm hungry. After, half an hour to an hour, your body might say, what the heck's going on? Make them shaky and make them sweaty and make them dizzy. It's trying to give you a sign to eat, because the next stage, people will get confused. You're standing out in the street looking at the sky, and patients or people are looking at you like, this person's crazy. It's not that you're crazy, it's that the blood sugar is dropping. Then the next stage is people get really, really tired, and they might want to, lay wherever they're at, fall asleep, and maybe they don't wake up, depending on medication and when the last time they ate. But low blood sugars are very, very dangerous, and we say anything under 70 is a low blood sugar. However, if a patient has a blood sugar of 500 all the time, just for example, when they hit about 200, they will feel a low blood sugar. They will feel the shaking, the sweatiness, the dizziness, the blurry vision, the anger, the fatigue, the irritability, the fast heartbeats, because their body is used to being 500, and 200 for them is actually low. So how do we treat a low blood sugar? Well, you can treat a low blood sugar with something like 5 to 7 lifesavers. Half a can of regular soda, not diet. Diet has no sugar. Tastes sweet, but there's no sugar. You can use 4 ounces of juice. You can use things like glucose tablets. Glucose tablets, they sell them in your pharmacy. They're over the counter. They come in different flavors: grape, orange, nectarine, tangerine, whatever. Basically 3 to 4 of those, they're about the size of a Tums. 3 to 4 of those has the same amount of sugar as 4 ounces of juice. Or 5 to 7 lifesavers, or half a can of Pepsi, or 2 tablespoons of raisins. So basically, a Snickers will work if that's all you have, but the Snickers is going to take time to digest. So if you drink juice, this is going to work in about 5 to 15 minutes. So let's say somebody was shaky and sweaty, and they drank some juice. In about 15 to 30 minutes, they're going to feel a lot better. So let's say you test, the sugar was 60. They drink juice, and now they feel 15, 30 minutes, they feel better. Now they test and they're 90. So they went from 60 to 90 because the juice brought their sugar up. But now they're going to want to have something like
half a glass of milk, like half of this, and half a sandwich. So picture, the sugar is dropping, the juice brings it up. But if they don't eat, basically their medications could put their sugar right back down. So when their sugar comes up after they drink the juice, having this keeps their blood sugar stable until their next meal. All right, so let's talk about the diet. Now, on a plate, half of a plate should be more what we call non-starchy vegetables. These are going to be things like carrots, broccoli, avocado, green beans, cucumbers, cauliflower, lettuce, tomatoes. I don't have them, but asparagus, spinach, kale, zucchini. I'm going to give you a whole list in that ebook. So half the plate should be non-starchy vegetables. Now, a quarter of the plate should be your protein. Proteins are going to be things like meats, cheeses. They could be cheese slices, cheese sticks. It could be fish, it could be shrimp, it could be chicken, it could be eggs, ham, turkey, pork, nuts, peanuts, walnuts, pistachios, almonds. Those are considered proteins. Now, milk and yogurt, and I'll show you, milk and yogurt are considered carbohydrates or sugars, but cheeses, cream cheese, cottage cheese, sour cream, and cheese, those are considered proteins. All right, so let's talk about the carbohydrates. Now, carbohydrates are what turn into sugar in the body. Now, we need carbohydrates for energy. If you don't eat carbohydrates, you're going to be tired, you're going to be fatigued. It's kind of like if you don't put gas in a car, you're not going to have any gas to go anywhere. So you want to put gas in the car, you want to put carbohydrates in the body so that we have some energy for sugar. We don't want to have too little, we don't want to have too many. Now, there are some vegetables that have starch. These vegetables are going to be the corn, the peas, and the potatoes. Now, I'm not saying not to eat these, but we have to count these. And what I mean by counting, for carbohydrates, we have to count how many grams we're going to have per meal. So, first of all, 15 grams is what we use as a reference point. 15 grams of carbs equals 1 carbohydrate choice. What that looks like is, for example, this is rice. A serving of rice, it's basically palm size in the hand, no thicker than a deck of cards. So that is 15 grams of carbs. Now, for women, we want you to have between 30 to 45 grams of carbs, which would be 1, 15, 2 of 15, 3 of 15. So add that up, 15, 30, 45. So what are carbohydrates as far as the foods are concerned? Rice, corn, peas, beans, pastas, breads, tortillas, all fruits are carbohydrates. Now, like I said, we need carbohydrates for energy. So for women, we want women to have between 30 to 45 grams of carbs per meal, not per day, per meal. So on a plate, let's say a woman had 1 tortilla, that's 15 grams of carbs. 2 tortillas, that's 30 grams of carbs. Let's say she had 3 tortillas, 45 grams of carbs. 1, 2, 3, and each one is 15, so 15, 30, 45 grams of carbs. Now, if she wanted to have rice, a woman wanted to have rice, she can have the rice, but she's going to have to sacrifice 1 tortilla, which is going to give her 15, 30, 45 grams of carbs again. Now, also, milk is a carbohydrate, and with milk, it doesn't matter if it's whole milk, 2%, 1%, 0%. The percent changes the amount of fat in it, not the sugar. They all have the same amount of sugar. Is 2% better than whole milk? It's better in the sense that it has less fat, but the amount of sugar is the same. Because we do want to watch the amount of fat that we bring into our body. So watching the fat and the sugar, 2%, 1%, if you like the watery milk, would be fine. If a woman wanted to have 15, 30, 45 grams of carbs, this would be fine. Now, this is not all she's going to have. For men, men get 3 to 4 carb choices, which would be 15, 30, 45, 60 grams. 1, 2, 3, 4. 4 carb choices, each one is 15, 15, 30, 45, 60. For women, 15, 30, 45, 15, 30, 45 grams of carbs. That's per meal, not per day. Now, let's say if when you have carbs, you always want to have carbohydrates with protein. So let's say this is, meat, and we have pork taco, meat taco, and we have rice. Now, let's say we have this filled up with, say this was lettuce, and we put cheese. The cheese is a protein. The lettuce, if you put tomatoes, if you put salsa, those are all the non-starchy vegetables. Those don't have a big effect on blood sugar. So if you had 2 tacos with rice and you were still hungry, let's say you added a salad on the side, pretty good sized plate, but we only have 15, 30, 45 grams, the 2 tortillas and the rice, 15, 30, 45 grams of carbs. The protein doesn't necessarily raise blood sugar. Now you want to watch the protein as far as the fat content. If you're having pork every day, for example, pork chops every day, or carnitas every day, that has a lot of fat. Let's say one day you had carnitas, one day you had like chicken breast, one day you had beef, one day you had fish. Mix it up a little bit, lowers the fat content. So here, for men, if they had, for example, 1 tortilla, 2 tortillas, a serving of rice, a serving of beans, 15, 30, 45, 60 grams of carbs. They're still staying within the 60 grams. If they were hungry, they had a salad on the side. Okay, so that's the only real big difference between men and women, is that men get 1 more carb choice per meal. So when you have a meal, meals always should have the carbs and the proteins. If you just had protein, for example, if you just had meat and let's say you had a salad, well, this could be very healthy, but in diabetes, the crazy thing is when we don't eat carbohydrates, our livers, remember the job of our liver, one of its jobs is to make sugar. Your liver is going to see that you don't have very much sugar from the food, so remember it's dripping sugar all day long. So what it's going to do, the faucet is going to go on and you're going to get more sugar. Now, people without diabetes, this also happens, but as their sugar starts to rise from their liver, their pancreas has enough insulin to stop it. In diabetes, as the sugar rises from the liver, patients only have 20%. So they're not able to bring the sugar down as much. They're still going to be high, even though they're not eating carbohydrates. And then they're going to be really, really tired. So let's say if it was a woman, let's say she had 2 tacos here and a salad, 15, 30, and she has her protein, and then the vegetables are just made to fill you up. For men, if they had 3 tacos, for example, and if they don't want any rice or beans, that's great. They have 3 tacos, they put their meat in it, and then they have their salad. They're still getting 15, 30, 45 grams of carbs. They're still giving themselves energy, but they're not giving themselves an excessive amount of carbohydrates. If we have fruit, whether you're having an apple, green apple, or red apple, if you're having grapes, now half of a banana is 15 grams of carbs. Any fruit baseball size, orange, apple, pear, for example, pear, nectarine, peaches, anything that is baseball size, that is 15 grams of carbs. Now this is watermelon, this is chopped up watermelon, palm size again, no thicker than a deck of cards. Or this is like a melon, so if you're slicing a watermelon this size, or this is just regular melon, that's 15 grams of carbs. Now the best time to have fruit technically is going to be with your lunch or with your dinner. You don't really want to have fruit as a snack. I know growing up it's very, very healthy if you have, well, let's get an apple as a snack. The only dangers of that is an apple is pure sugar. So let's say somebody had 2 tacos at lunchtime. So they got 15, 30 grams of carbs. So, and they have a salad, so it's very healthy. It's the right amount of carbs. Let's say if they tested their sugar afterwards, their sugar is, I don't know, 100, 120, really good. Then they have an apple about 3 o'clock, pure sugar. So if they were 100, 110 here, they have this apple, chances are their sugar is going to rise after they have that apple. Now, ideally, because they only have 15, 30 grams of carbs with their tacos here, put the apple with the meal. And the reason is these proteins are here. What do proteins do? For one, they're going to slow the digestion of the sugar, and proteins are called insulinogenic. What that means is that proteins stimulate your pancreas, which your pancreas makes insulin, to make insulin. So it's a win-win when you have protein with your meals. Now, once in a while, I'll tell patients that if you're gonna have a fruit, let's say you forgot to have your fruit at lunchtime, but you're craving that fruit at 3 o'clock in the afternoon, well, get that apple, and let's say I don't have peanut butter, but let's say you have peanuts here, peanut butter. You put peanut butter with your apple. That's when you would do that. I tell patients most of the time, if you can be good 90% of the time, be bad 10%. This isn't being bad, but this is something that you don't want to do every day. Now, if you had a donut at 3 o'clock, that's being bad. But if you haven't had a donut in a month and you have one today, it's not a bad thing. But if you have a donut every day, then that's being bad. That's basically giving your body too much sugar. And the issue with that is the pancreas used to be able to handle that. You could have a dozen donuts, and as that sugar would rise, your pancreas would put that back under control. But when the pancreas is making 20%, that liver, the donut, those sugars are going to be super, super high. So the main thing is that when we have a meal, we always want to have protein, carbohydrates, and then the non-starchy vegetables are made to fill us up. When you have the carbohydrates, remember for men, it's 3 to 4, which is 15, 30, 45, 60 grams of carbs with protein, and again, vegetables if you want. And then for women, it's 30 to 45 grams of carbs, 15, 30, 45 grams with protein and vegetables if they want to help fill them up. So let's talk about snacks. Snacks should be primarily non-starchy vegetables, say for example, carrots, and protein. So let's say you had, I don't know, almonds. So you have your non-starchy vegetable and you have a protein. If you like cheese sticks, you can have a cheese stick. If you wanted to have a boiled egg, have a boiled egg. So with your snacks, it could just be non-starchy vegetable. It could be protein. It could be protein and non-starchy vegetable. But if you had, for example, let's say you had a piece of chicken with carrots. It's a weird snack. But if you had that as a snack and then you wanted a taco, well, not really have this as a snack. This is fine at lunchtime. Let's say you had 2 tacos with the carrots at lunch. You have your carbs, you have your protein, and the vegetables just to fill you up. So if you had this at lunchtime and you wanted a snack afterwards, take away the tortillas, eat the protein, eat the non-starchy vegetable. Now, if you had carrots and you wanted to dip those in ranch or sour cream and onion dip, sour cream, remember, technically is a protein. It does have a lot of fat, so you want to get the lower fat version. Or if you wanted to use, like I said, ranch, you just want to watch out for the ranch, because if you're having just dipping the carrots or the broccoli into the ranch, that's fine. But you don't want to be drinking ranch, because ranch does have some sugar in it also, and it has a lot of fat. So you got to be careful with low-fat products. For example, low-fat ranch or light ranch, it's going to have less fat, but in order to try to kill the taste, they're going to add things like sugar. So a quick recap. The pancreas makes your insulin, liver makes your sugar. You want to have carbs and proteins together, and vegetables are to fill you up for your meals. For your snacks, you want to have proteins or just vegetables, or proteins and vegetables as your snacks. Not so much the carbs. Once in a while, that would be fine. If you went to a wedding, a birthday, a baby shower, your birthday, whatever it is, and you want to have a piece of cake, eat the cake, drink the punch. But that should be kind of more of a rare thing versus a daily thing. The whole idea is we want to preserve the amount of insulin that our pancreas can make. And if we're constantly beating up our pancreas, we're going to start killing more and more cells. And basically, we're going to need more and more medication and or more insulin if people are taking insulin. So now let's talk about a label. Now in the ebook, I'm also going to put in a label. Now the main thing that you really want to look at in a label is the carbohydrates. On a label, you're going to see that there is sugar listed. Yes, you can take a look at the sugar, take a peek at the sugar, I tell patients, but don't pay attention to the sugar. You want to really focus in on the carbohydrates. And then how much is a serving? So for example, if you had a soup, for example, this is not a soup, but if you had a soup and the label said 15 grams of sugar, okay, don't pay attention to the sugar, look at the carbs. If it says 36 grams, for example, per serving, that means this whole cup of soup would be 36 grams of carbs, not 15 grams of sugar. The reason is the sugars are actually counted in the carbs. So in that 36 grams, if it said 36 grams of carbohydrates, those sugars are counted in the carbohydrates. So let's look at a sugar-free product. If this was a sugar-free soup, for example, the sugars will be listed as 0. But the carbs, if it still says 36, that means whenever they made this soup, or whatever they made, they just did not add any extra sugar to it. So now let's change this and say this was a pudding, sugar-free pudding. What they do here is the sugars will say 0 if you look at the label. But the pudding, if it's a vanilla pudding, for example, it's made with milk. So the milk has natural carbohydrates in it, or natural sugars in it. So if this says, it's going to say, for example, pudding, the sugar-free pudding is about 14 grams of carbs for one little pudding. So there's no added sugar to it, but the sugar is in the milk naturally. So if this was 15 grams of carbs and you had, for example, let's say this were 2 tacos. If you had 2 tacos, so 15, 30, and this was 14 grams, we'll say 15, 30, 45 grams of carbs. Put the pudding with the meal. Try not to have the pudding as a snack, because then you're getting basically pure sugar again. Even though it says sugar-free, it's still made from milk. So you always want to pay attention to the carbohydrates and to the serving, not the sugars when you read a label. So let's talk real quick about cereal. So let's say this is cornflakes. Not sure what this actually is, cornflakes, or if you had Cheerios. Cornflakes are made from corn. Corn is a carbohydrate. So let's say this is 1 serving, and let's make that 2 servings of cornflakes. So remember, each serving is 15 grams, so 15, 30. Milk, in this size of milk, this is about 15 grams of carbs. So it's 1 cup. Remember, it doesn't matter if it's 2%, 1%, 0%, or whole milk. It's 15 grams because the percent changes the fat. We have 15 grams, 30, 45, because there are 2 servings in the cereal. If that's what your cereal has, because most patients, for example, most people, if this was a serving or 2, we don't eat that much. We eat it till it spills over. So let's just say that was 2 servings. And then we added our third one, which is our 45 grams. So for women, this is perfect. The only problem with this is that it is pure sugar. So how do we fix this? Well, carb-wise is the same. We keep that. But what we need to add, it does not have to be eggs, but we need some type of a protein on the side. Remember, protein slows the digestion and helps the pancreas, or stimulate the pancreas to make more insulin. We want to have protein with our cereal. It sounds really strange to have eggs with your cereal. So just real quick with eggs, they recommend no more than 2 yolks per day. The yolks contain the fat and the cholesterol. So if you had 2 scrambled eggs for breakfast and you wanted 2 boiled eggs for lunch, take the yolk out of those. But if you're not having eggs every day, you can do that. So let's say it's Wednesday today and you had 2 scrambled eggs for breakfast and then you boiled 2 eggs for lunch, but you don't have any the rest of the day or on Thursday or Friday, that's fine. But if you had 2 for breakfast every day and then you had 2 boiled eggs every day for lunch, that's a little bit too much cholesterol. So they recommend 2 egg yolks per day, but you can have all the egg whites you want because those are protein. If you had protein with your cereal, strange combination, but you could do that. Now oatmeal, this is not oatmeal, but if this was a serving of oatmeal, we'll say it's 2 servings of oatmeal. So we have 1 serving, 2 serving, or 15, 30 grams. Let's just say we put 3 servings. So we got 45 grams of oatmeal. It's best to make the oatmeal with water, not with milk. And then on the side, we still need some type of a protein. You can add Sweet and Low, Splenda, Truvia, Stevia, whatever the fake sugars are in here to make it sweeter. You can even add cinnamon for flavoring. Cinnamon actually helps burn blood sugar inside the body. It makes you hot. It's called a thermogenic. Now, if you add all that into your oatmeal, you still need protein on the side. And it's best to buy the oatmeal that is in the tubs, like the Quaker Oats, versus the little packages. However, the regular oatmeal in the packages has about the same amount of sugar that comes out in the tubs, but not the apple cinnamon or the strawberry cinnamon or whatever flavors that they come out with. It's best to get the more plain one, or just make it in the tub yourself. So I also tell patients, if you're gonna have cereal in the morning, let's say you had cornflakes and you had a side of eggs, Maybe do that once or twice a week. You don't want to do that every day. So what other options do you have for breakfast? Well, you have, let's say if you had chorizo and eggs in a tortilla. Well, the tortilla is your carb, and then the chorizo and eggs are your protein. So speaking of tortillas, so corn tortillas are about 15 grams of carbs. Flour tortillas are about 20. I tell people if you want a flour, put a corn on top, trace out the extra. Now that flour tortilla is approximately 15 grams of carbs. As far as breads are concerned, if you had one slice of white bread, one slice of wheat bread, or let's say this is sourdough. I don't have sourdough. So they're all approximately 15 grams of carbs. So if you had 15 grams, 15 grams, and 15 grams, so what's the big difference in breads? The difference is how they digest. So let's say you ate all three, and in your belly, they're gonna run a race to see which one's gonna raise your sugar the fastest. First place is gonna be the white bread. It's pure flour. Second place is going to be the wheat. It has fiber, so it digests a little bit slower. Sourdough is an acidic bread. Whatever that does to the bread, it digests even slower. So if you had the option, the wheat bread and the sourdough would be a better option. But you don't have to avoid white bread, just know it will raise your blood sugar a little bit faster. It's kind of like white rice versus brown rice. This is not brown rice, this is beans. But if you had a serving of white rice and a serving of brown rice, what's the difference? Carb-wise, they're about the same. This is about 15 grams, this is about 14 grams. Not a big difference carb-wise, but what's the difference? The difference is how they digest. So if these were gonna run a race in your belly, the white rice is gonna raise your sugar a lot faster than the brown rice. Think of this, when you cook white rice, it cooks pretty quick. If you cook brown rice, it takes quite a while to cook. So think of your stomach being challenged to digest that a little bit slower. So what does that do for your blood sugar? The slower a blood sugar rises, the more time your pancreas has, or your medication has, to give you insulin. Now I hope that helps out with the diet. Now we do want to have carbohydrates with every meal. Snacks, you want to have your non-starchy vegetables, which for example, broccoli, a serving of broccoli has about 5 grams of carbs. All the non-starchy vegetables do have some carbs in them, about 5 grams. We kind of say they're a little bit on the free side, but you don't want to have a bag and bag and bag of carrots or broccoli, for example. You do want to have those in moderation, but use those to fill you up. Same thing kind of with the protein. The issue is when people try not to have carbs, remember, their liver is going to give them sugar, and then they're going to feel tired. Even though the liver is giving them sugar, it's to keep their brain alive, to keep their body alive, but it doesn't give you energy like sugar from food or carbohydrates from food. So you want to have the carbohydrates, whether you're doing 30 to 45 grams if you're a female, or 45 to 60 grams. At the lowest, at a minimum, 30 grams of carbs per meal, which would be equivalent to 2 tortillas. Or if you had a sandwich, for example, 1 bread, 2 bread, you put those together, and then you put whatever meat on the inside, you're still getting 15, 30 grams of carbs. And that's what we want. We want to have the carbs. We don't want to go over crazy on the carbs. Let's say you have a bag of chips, and in that bag, there's 30 grams, and you cut it in half, well, that's 15 grams. So if you have a handful of chips, 15 grams, and then you have 15 grams here, 15 grams there, 15, 30, 45 with the chips. Now to drink, you want to drink things like, of course, water. The other thing is you kind of want to avoid are juices and regular soda. If you have to have a soda, diet has no sugar in it. It does taste sweet. Some patients say that it's sweeter than regular soda. It is sweeter than regular soda, but there's no sugar in it. It's the fake sugar that they put in it. And the fake sugars that they use in sodas are about 200 to 400 times sweeter than real sugar. That's why diet soda tastes sweeter than regular soda, but there's no sugar in it. So people say, well, I'd rather drink the regular soda because it doesn't taste as sweet, but it's sugar, whereas the diet has no sugar in it. And it doesn't matter if a soda is clear or dark. It matters whether it's diet or not. If you can have Sprite or Pepsi or Dr. Pepper or root beer, those all have the same amount of sugar. Now, if you had Diet Sprite, Diet Dr. Pepper, Diet Pepsi, Diet Coke, Pepsi Max, Coke Zero, those have no sugar in them. Like I said, I'm gonna make the ebook available to you. You just have to enter your email. Not that I want your email, but that's how I do it for other things. But you basically put your email in there, say that you agree to like get information from me or whatever, and then you can actually download the ebook and use it, as a reference. Then you can also go back to look at this video. Hope that helps. Goodbye. Take care, family.